Hey, I'm Jeremy Suess from Clackamas Smiles. A dental implant is a replacement tooth. Really, the implant itself is more like a replacement root. It goes below the surface and it anchors in the bone. Once that's in and solid and stable, then we attach something on top of it, a connector and then a tooth. So most people, when they say implant, they're like, when do I get my tooth? But the reality is the implant's below the surface and then the tooth comes later. We call that a crown. So when it's completely finished, you have the anchor in the bone, which is the implant, and then you have the tooth on top that chews our food. You can brush it, you can floss it. It really is a great replacement for a lost tooth. When people ask me who's a good candidate for dental implants, the answer is really all walks of life and most ages. One of the rules is that you can't still be growing, so no kids and no youngsters. But once you're pretty much finished growing, you're a good candidate for a dental implant. There's some other criteria, like medically you have to be pretty stable and no bleeding disorders and nothing of that sort. But those these days are more and more rare. So what we find is when we have consultations, it's pretty rare that we find someone whose medical condition keeps them from being a good candidate for an implant. So the answer would be anyone who has a missing tooth or a tooth that isn't doing so well that they want to replace, and they don't like the sound of something removable. They don't like the sound of a bridge. They don't want it connected to the teeth around it. They really just want a replacement root and they want their own tooth back. An implant is probably the most straightforward way to give them that. When I get asked how much implants cost, the answer is it varies. Part of the reason for that is you have to find out what's going on below the surface. So an implant is only as stable as the bone that anchors it in. And so if you have a wonderful bone and a really good foundation, then implant's pretty straightforward. I've seen implants going for a couple $1,000s. Now, on top of the implant itself, you want to get a connector and you want to get a crown. So what good is an implant if it's all below the surface? You want a tooth on top of it. So the tooth is usually charged separately. And the two of those together, commonly right around $5,000, $5,500 is a really average price for an implant. The exception to that would come if you don't have enough bone, if you've had atrophy of the jawbone, if you've had a lot of damage, or if there's something else in the way right now, let's say an ailing tooth, there's something that's in there that's failing that needs to be removed and rebuilt, that's additive to the cost of an implant. So there's lots of situations where a tooth needs to be removed, the area needs to be fixed or repaired, and some time has to go by before we can start the implant process. And that's why it's important to see what's there now and what condition it's in before we can say, yeah, this is a much more straightforward process with a very predictable fees, or this is something that's going to take a lot more work and there's a whole rebuild stage that comes ahead of time. But that you never know until you look. So what we recommend patients do is come in for a consultation and say, hey, what is it? What does it look like? Is there a good area for the implant? And if we can expedite that and not do a whole bunch of work and get the implant in there, that's what we do. And in rare cases, we have to do that rebuild first. Can implants be placed at the same time that the tooth comes out? That's actually more and more common as time goes by. That used to be something that we would shy away from, and we wanted everything to be healed and set and calm, and then we implant the surgery itself for the body of the implant later. We're not doing that nearly as much. What's much more common is to take the tooth out, repair the bone, and place the implant at the same time. And the advantage is it saves a lot of time, and it turns two surgeries into one surgery. Our success rates have been almost the same with immediate implants as delayed implants. So as long as your tooth is still stable enough and the bone around it is still stable enough to hold that implant, or if it can be rebuilt at the time of the surgery, I think considering having the implant placed at the same time the tooth comes out is a really good idea. And that's a question you should ask in your consultation. So the steps to complete an implant are, there can be quite a few steps. It's pretty simple. You have a tooth that's gone, and you have some bone that's there as a foundation. The implant goes in and it gets nice and stable. Think of a fence post in some dirt. Once that's nice and solid, then we attach something on top of it. So if it was a fence post, we'd be building a fence, but this is an implant, so we'll be building a tooth. Once it's in, it's set, it's stable, and it's healed, then the tooth gets connected to the top of it. Along the way, each of those steps have details. For example, the surgery step could be removing an old tooth that's there, rebuilding the bone, placing the implant, covering it up and letting that heal. Some time might need to go by. After that's done, it could be uncovering it, making sure that it's solid, it's stable, that all the healing has finished, And then we get to connect the tooth part. That's usually what the patient's excited about. When do I get my tooth? When can I chew? When can I brush? When can I smile? The answer is after that first step of healing is done. When we connect the tooth on top, as soon as the bite's in the right place and everything is stably connected, the answer is your implant's done at that point. You get to enjoy it and chew the food that you want and smile and brush and floss and really treat it like it's your own natural tooth. So those are the overall steps that take you from a missing tooth to a completed implant. The success rate for dental implants is right around 95% success rate. Nothing man-made lasts forever, and so there can be trouble or maintenance along the way for a traditional filling, a regular crown, a bridge, veneers. Same holds true with dental implants. But one of the nice parts is the failure rate for dental implants is actually lower than a lot of the other traditional dentistry that we do. So it's not uncommon to expect your implant to last 10 years, 15 years, 20 years, 25 years. There's nothing inherent in an implant that goes bad, expires, or deteriorates. So it's not uncommon for an implant to last your whole entire life. When patients ask me if I should get my tooth extracted first and then go back and place the implant second, I would recommend caution. It's pretty simple and pretty straightforward to place an implant where there's no tooth, but there can be some drawbacks. And one of the main drawbacks is atrophy of the bone. If we're missing a tooth, if there's nothing in that space, the jawbone has a tendency to shrink, both in its height and in its width. There's actually less of it. As time goes by, that gets more and more accentuated. So when a tooth is there, even if it's maybe not perfect, even if you know it needs to be extracted, what I would say is get the consultation for the implant while that tooth is still present. And if there's a chance that the implant can be placed at the same time, for example, the tooth comes out and the implant goes in, a lot of times that's a more predictable procedure because it's a lot better for the bone in that area, and it doesn't let that atrophy occur as time goes by. You can avoid that step by having an immediate implant. So the answer is, yeah, it's possible to have your tooth extracted first, but it's rare that it's actually better to have the tooth extracted first, and it's more common that you'd want it placed at the exact same time, an immediate implant. I'm Jeremy Suess with Clackamas Smiles. Our number is 503-786-3000.